Hello everyone. So today we will discuss about the fluid restrictions in CKD patients, that is chronic kidney disease patients. It was actually the time when I was posted in the nephrology ward, and there people usually come for dialysis, and sometimes they get admitted there, and they have to maintain fluid balance there. Okay, so there a patient asked me like the doctor has said not to exceed 1 liter of water in a day. So what can I do for that? So how will I manage it? She had lots of questions based on it. So being a clinical pharmacist, I thought that yes, I have to tell something to the patient in order to restrict the fluid, how to control the thirst, because that was very hot climate on that day, and I myself drank 4 liters of water. So I was like, how will the patient control the thirst? So, but as the situation was critical, as the patient was in dialysis stage 5 of chronic kidney disease, so it was my duty to tell some of the points that could control the thirst of the patient. So this is the topic what I want to discuss, and let's start with the topic. This topic mainly concentrates on the point like how to control the thirst in later stages of kidney diseases, because your kidney will be capable of filtrating 1 liter in a day. So in later stages of kidney disease, this is the situation where your kidney cannot filter if you take more water also. See, when you take more amount of water and it cannot filter, what happens? All the fluid will be getting accumulated. The fluid overload happens. When there is fluid overload in the body, automatically the blood pressure of the patient will increase. When the blood pressure of the patient will increase, what will be there? Again, the edema can be seen. That means the swelling of the legs, ankles. So slowly the swelling will spread in the body, and finally there is a life threatening condition that happens, is the pulmonary edema or life threatening situation. So only they restrict the fluid to 1 liter, maximum 1 liter. The measuring bottle is also there. Okay, a normal water bottle, 1 liter bottle, you fill in that water of 1 liter, then see that in one day you just drink that much amount of water. So that is a situation in chronic kidney disease patients, what we suggest usually. So first point, how they can control the thirst is by using mouthwash or frequently brushing your teeth. So that keeps your mouth cool, and hence the thirst will be reduced. Next is better using of chewing gums. So this chewing gums, what they do, they will maintain the moisture in the mouth, like saliva will be producing, so that will help in preventing the dryness of the mouth and thirst in the patients. Next is they have to see that they will limit the sodium, salt, as well as the spicy food, salty and spicy foods, which will prevent the thirst. If more amount of salt and spicy foods, if they start eating, they get more thirst and they have to drink water. So here, as there is fluid restriction, so they have to control these two things, and hence they can control their thirst. Next is they can try drinking cold beverages instead of the hot one. I'm not speaking about soda kind of beverages. This is about the water. Okay. If cold you drink, see, whenever we drink cold water, what happens? We just drink 1 or 2 sips. When we drink that only a normal water, we finish one glass or one bottle very easily. Right. So when they prefer cold beverages like cold water, like 1 2 sips is enough to reduce the thirst at the particular time, right? So we suggest this. And the patient have can also sip the drink, or that means they can take 1 sip of water, keep that fluid in your mouth for a longer period of time, and instead of suddenly drinking that water, keep it in your mouth for some time, so that you will drink less amount of water when you compare to the condition where you drink water very fastly, right? Then, whenever you're thirsty, if you have ice cubes in the home, just lick it 1 to 2 times. You can lick that piece of ice, so that you no need to drink more amount of water and control that 1 liter of maximum water in a day. Next, whenever you're drinking water, see that you take a very small cup of water. When you take the water in a bigger glass, what happens, you don't have an estimate, you suddenly try to drink everything to reduce your thirst. So take the water in a very small glass, okay, so that you will have a measurement, and yes, you can control your thirst by drinking little amount of water. Now these CKD patients, that means chronic kidney disease patients, have many tablets to be taken. Okay, so they ask me like, yes, I have to take so many amount of tablets, how can I take it without water? So I mainly suggest them, you can take it with your food, no problem. You just mix it with your food and take it. If you take all these tablets with one glass of water, then you will be fluid overloaded very fast. So it's better that you take it with your food. It is recommended for these kind of patients, rather than taking it with one glass of water. So this is all the points that I had given to that patients. I request you all to share this video with the patients who have CKD, or who are want some suggestions on controlling their thirst whenever they have these situations. So thanks for watching the video. Please do like, share the video and subscribe the channel. Thank you.